Welcome back, our fans. Behavior management. Definition. It is defined as means by which the dental health team effectively and efficiently performs dental treatment and thereby keep a positive dental attitude. 1975. A. Non-pharmacological approach. 1. Communication. 2. Behavior shaping. 3. Behavior management. B. Pharmacological approach. 1. Premedication. 2. Conscious sedation. 3. General anesthesia. Levels of anesthesia. Topical and local anesthesia. Conscious sedation. Deep sedation. General anesthesia. Definition. Conscious sedation. It is a controlled, pharmacologically induced, minimally depressed level of consciousness that allows protective reflexes to be maintained, retains the patient's ability to maintain a patent airway independently and continuously, and permits appropriate response by the patient to physical stimulation or verbal command, e.g. open your mouth. Deep sedation. It is a controlled, pharmacologically induced state of depressed level of consciousness from which the patient is not easily aroused and which may be accompanied by a partial loss of protective reflexes, including the ability to maintain a patent airway, independently respond to physical stimulation or verbal commands is partially lost as well. General anesthesia. A medically controlled state of unconsciousness accompanied by a loss of protective reflexes, including the inability to maintain a patent airway independently and respond to physical stimulation or verbal command. Conscious sedation. Definition. A technique in which the use of a drug or drugs produces a state of depression of the central nervous system, enabling treatment to be carried out, but during which verbal contact with the patient is maintained throughout the period of sedation. The level of sedation must be such that the patient remains conscious, retains protective reflexes, and is able to understand and to respond to verbal commands. Advantages of sedation in pediatric dentistry. For dentist. Promote patient safety, needle breakage. Provide high-quality care. Minimize the extremes of disruptive behavior. Promote a positive psychological response to treatment. Prevent burnout syndrome. Advantages of sedation in pediatric dentistry. For the child. Prevent developing of dental fear and anxiety. Facilitate coping with the treatment. Building of a healthy positive relationship with the dentist. Raise the success of the dental treatment. Disadvantages. Some common side effects of conscious sedation may last for a few hours after the procedure, including drowsiness, feelings of heaviness or sluggishness, loss of memory of what happened during the procedure, amnesia, slow reflexes, low blood pressure, headache, feeling sick. Indications for conscious sedation in pediatric dentistry. Dental anxiety and phobia. Prolonged or traumatic dental procedures. Medical conditions potentially aggravated by stress such as angina, asthma and epilepsy. Medical conditions affecting the patient's ability to cooperate. Patient lacking cooperation because of lack of psychological or emotional maturity. Special needs. Mentally/physically disabled or medically compromised patients exhibit severe anxiety when visiting a dental office. It may be caused due to a number of factors, including fear of the unknown, inability to communicate one's feelings and reactions to sensory stimuli. According to the extent and severity of the disability, conscious sedation should be considered as an option before thinking about deep sedation or general anesthesia. Involuntary movement conditions. Various medical conditions, such as Parkinson's disease, multiple sclerosis and cerebral palsy, affect the child's ability to maintain an open mouth during dental treatment. Conscious sedation often helps in reducing these involuntary movements through muscle relaxation and anxiety reduction. Contraindications for conscious sedation in pediatric dentistry: chronic obstructive pulmonary disease, COPD, respiratory infections, and bleeding disorders. Uncooperative or unwilling patients. Unaccompanied patients. Prolonged surgery. Lack of equipment or inadequate personnel. Patient selection and assessment. 1. Obtaining patient history and information. Age, weight, height/health history/systems review/airway evaluation. 2. ASA, the American Society of Anesthesiologists, physical status. Classification. 3. Instructions to parents pre-op and post-op. 4. Informed consent. 5. Adequate documentation of the sedation experience with monitoring of vital signs. Review of patient's medical history should be assessed and should include patient assessment, history of previous allergic or adverse drug reactions, medications including dose, time, route and site of administration, systemic disorders, previous hospitalization to include the date and purpose, fitness for conscious sedation grade. Children who are ASA 1 or 2 can be fit to undergo conscious sedation in the clinic. Those who are not in these categories requiring conscious sedation should be treated in a hospital environment with due consideration to their individual needs and medical condition. Informed consent. Informed consent from patient parents or guardians must be obtained prior to the conscious sedation appointment, including 1. Dental treatment under conscious sedation. 2. Explanation of the sedation technique proposed. 3. Changes in behavior possible. 4. Pre- and post-operative instructions. 5. Possible side effects. Routes of administration. Enteral any technique of administration in which the agent is absorbed through the gastrointestinal tract or oral mucosa, i.e. oral, rectal, sublingual, parenteral a technique of administration in which the drug bypasses the gastrointestinal tract, i.e. intramuscular, intravenous, intranasal, submucosal, subcutaneous, SC. Transdermal a technique of administration in which the drug is administered by patch through skin. Transmucosal a technique of administration in which the drug is administered across mucosas such as sublingual or rectal. Inhalation a technique of administration in which a gaseous or volatile agent is introduced into the lungs and whose primary effect is due to absorption through the gas/blood interface. Routes of administration. Inhalation sedation, X, nitrous oxide/oxygen sedation. Oral sedation, X, choral hydrate. Intravenous sedation, benzodiazepines, including diazepam and midazolam. Rectal sedation, midazolam, half a milligram / intramuscular sedation, ketamine. Submucosal sedation. Routes of administration. Oral. It is the most universally accepted and easiest method of sedation. Administration. Advantages of oral sedation. A universal acceptability. B. Ease of administration. C. Low cost. D. Effect appear after 30 minutes. Drug peak require 1 hour or more. E. Incidence of adverse reactions less than some other techniques. F. No needles, syringes or special techniques. G. Various drugs, dosage forms available. H. No specialized training. Disadvantages of oral route. A reliance on patient cooperation. B. Prolonged onset. C. Prolonged duration of effect. D. Erratic absorption, unpredictable effect. E. Inability to readily lighten or deepen. F. Inability to titrate to effect. Contraindications to oral sedation. A severe dental anxiety and fear. B. High probability of adverse drug interaction. C. Poor past experience with oral sedation. D. Allergy to drug being used. E. Other drug contraindications, pregnancy, glaucoma, etc. F. Eat for rapid onset and/or rapid recovery. Thanks for watching. Support us by likes and subscribes.